Here's a quick video on our drugs that we use for hemorrhage. So in the case where the placenta is delivered or the placenta is not delivered and you have an IV running, you would give oxytocin. And the reason why there's two levels here is because this first one is for normal spontaneous birth. But if she's been induced or augmented, if the rare case that you have a case like that, her uterus really does need a bigger dose of oxytocin to respond. And so that would be this dose. So for majority of cases, you're dealing with this one. And you put 20 units in the bag of normal saline run by IV open wide, which is about 600 mils per hour. And you'll see a peak within a minute, and it lasts for about 20 minutes after discontinuing. So you don't want to stop this medication running once she stops bleeding. You want to step down this medication. So you might go to 300 mils per hour once everything's settled and just have a check in 20 minutes to see, can you trust your uterus? Did she, or has she started bleeding again? Your aim after a hemorrhage is to step down to 300, give it some time, make sure you can trust her at 300 mils an hour, and then down to 150 mils an hour. And you can keep that going for about, say, 6 hours, and then move her to normal saline and check if you can trust her for just on normal saline while you're monitoring in the department. In the case where the placenta is not delivered, you would keep this running. And you also have the option of cyclocaprone. So she's bleeding, you're preparing to do a manual removal of the placenta. You can also piggyback on cyclocaprone 1 gram in a 50 ml bag IV. And the instructions are to run at 300 mils an hour over a 30-minute period. And you want to do that within 3 hours from the start of the hemorrhage. Once the placenta is delivered, she's still bleeding. You've got the oxytocin running. You can opt for misoprostol is your next drug. And this is a simplified recipe. So you might see in other texts anywhere from 400 to 800 or a range. We just do 600. So 600 micrograms sublingual. So that's 3 pills under the tongue. And you'll see a peak in 30 minutes and it lasts for 2 hours. In the case where she's had the hemorrhage, everything's slowed down, she's, you're just tucking her in for just post-hemorrhage monitoring, you could do 3 pills or 600 micrograms per rectum, and then you'd see a peak in 60 minutes, and then at 6 hours it would be wearing off. And so you want to ensure that, again, you want to know when your medication's wearing off because you want to include a full assessment at that time to see if you can trust her to keep her uterus contracted. The way I remember this is 30 minutes is 1/2, so there's a 2, and its duration is 2 hours. And for the parectal, it's 60 minutes and a duration of 6 hours, so a 6 and 6. So that might be helpful for some people. In the case of ergot, these are your next line. So these ones are available in the medication fridge and in the delivery room. This is in the medication cupboard. This is in the medication cupboard or delivery room as well. This is in the medication cupboard, and these are in the refrigerator. For the Medivac, these are all in your first Medivac bag for normal, maternal, newborn. And these are ones that you need to get out of the fridge, the vaccination fridge, before you leave on the Medivac. So the ergot, you can give 0.25 milligram IM, or you can give 0.25 milligram IV slow push over a minute. Either are fine. Just that they're contraindicated. It's contraindicated if it's a case of hypertension. And the Hemabate, if you can buy yourself some time, just pause, see if she would be, she's stable enough that she can have 1 capsule of Imodium, and then 20 minutes later give the Hemabate. It'll make your transport or your management of the hemorrhage better if you don't have to deal with diarrhea. So you'll find this table in the delivery room, at the medication cupboard, in the Medivac bag, and it's in our aid memoir in our Medivac kit. as well as we sent a copy to the villages. So it's just something to refer to so that we each systematically go through the same steps for reaching for the medications as we need them.